Welcome everyone. My name is Tracy Earle and I'm from the Safe Communities Foundation New Zealand. Along with Megan Brotherton from the Australian Safe Communities Foundation, we are your hosts for this webinar. Before we get started, I'd just like to go through a few housekeeping matters. We have 3 interesting presentations today and we'll have time for questions after each presentation. So do please ask questions. We'd like this to be an interactive session. Each participant will have access to the GoToWebinar control panel on your screen. If you could familiarise yourself with its features, that would be useful. If you're having any problems at all, please send a message via the control panel and we will endeavour to resolve the issue. If you'd like to ask a question during the presentations, please type your question in the question area on the control panel on your screen. Alternatively, you can put up your hand. To do this, please click the yellow hand on your control panel. At the end of each presentation, depending on the time available, the presenters will try to answer your questions. If your question isn't answered, the presenters will provide an email address at the end of their session for you to correspond with them personally. This webinar will be recorded and will be available for viewing early next week. So let's get started with the presentations. I'd now like to introduce our first presenter, Dr. Bridie Scott-Parker, who is currently the leader of the Adolescent Risk Research Unit at the University of the Sunshine Coast in Australia. She is a National Health and Medical Research Council Senior Research Fellow and is the founder of the International Consortium of Adolescent Road Safety. Today, Bridie is going to present on looking at adolescent road safety in a different way.
Good morning, everyone. I'm just checking. So can everyone see a full screen presentation? Here at the university we have double screens.
We can see the double screen. That's fine. We can see your presentation, so that's good.
Fine, I'll get started. So thank you very much for joining me today. I lead the adolescent risk research here at the university, and having been in the young driver space for a couple of years now, it's occurred to me that we need to think about young driver road safety in a completely different way. So if we're thinking about young driver road safety, it's consistently found around the world that a popular way for a teenager to die is actually in a car crash. In Australia and New Zealand, we know when we've gone back through crash data that it's actually our 18-year-olds who are sustaining the most injuries and fatalities. Which brings me to this issue of training young drivers. So we can see on this screen, this is a breakdown of crashes according to the amount of time they've been licensed and which license they're actually on. When I talk to parents, and as a parent of a learner driver myself, I hear from parents that the learner phase is the most scary phase, they're going to kill me, this is the most dangerous time. The crash statistics just do not show that's the case. This is actually the most safe time in the young driver's driving lifetime because they have you, mum and dad, or a driving instructor seated beside them in the car, an extra set of eyeballs that can help detect hazards and react appropriately to hazards. We have this whole Jekyll and Hyde moment where they drive into their practical driving tests. They seem like quite a normal teenager. They drive in, they pass their test, and they turn into this totally different creature. They've now got their P plate. They're in Queensland here. We have a red P1 licence, and the crash rates spike exponentially and diminish over time. So much of my research is about trying to figure out what's going on. They seem quite normal as a learner. Here they are driving by themselves and they are way overrepresented in car crashes. So today I wanted to talk about what we actually do that I would argue is probably an old approach. We need to think about this with fresh eyes and then flag a couple of ways that we can actually do that in the real world. So we focus on fixing the adolescent driver, the teenage driver. We're all about educating. So you normally learn all about the road rules and any graduated driver licensing rules as a 15-year-old before you go to the government testing centre to sit your learner theory test. Then during that learner phase they need to do certain things. In Queensland we have some minimum practice requirements. They have to fill in a logbook with 100 hours certified supervised driving practice and then have a minimum of those hours 10 at night. So we have some night driving practice. Then they go off for a practical driving assessment before they can actually drive by themselves. Are we really educating? Are we educating the learner? When I talk to kids with a P plate, they don't remember a thing from the learner theory test. They don't remember a thing from the learner phase. It's all about what's happening now. Are we educating the right people? So mum and dad are actually the ones in the seat beside them. Do we help mum and dad? So reflecting on my own learner driver daughter, my husband has not read a single resource at all prior to actually getting out on the road. Perhaps unsurprisingly, and given my expertise, I'm the one actually doing the on-road driver training. Enforcement is a complicated bundle because the police are enforcing not only the general road rules, which everyone must adhere to, they're also enforcing graduated driver licensing rules. But who is enforced? So in Queensland, we can only detect if a P plate is doing the wrong thing if they've actually got their plate on their car. And same with the speed cameras. So if it's just a camera on the side of the road, the registered owner of that vehicle receives the speeding infringement notice and they have to nominate a driver. And I've heard on more than one occasion from a young driver, given they only have 4 demerit points, perhaps they were speeding at a threshold that meant that they would lose all 4 of those demerit points in one hit. Mum and dad have actually turned around and taken the fine for them because it would just be a complete pain in the bum for that learner, their young driver, not to have their driver's license. So who are we actually enforcing? Today we have amazing technology to help keep everyone safe on the road. Cars, the technology, the 5-star ANCAP facilities that are incorporating cars have never been better, and we're constantly making improvements. We also have fantastic interventions such as alcohol ignition interlocks, which simply will not allow the car to be turned on if the driver has breath alcohol detected. We don't have these as standard features in a vehicle, but we know young drivers are involved in crashes where they've drunk alcohol. We also know young drivers tend to be in older, smaller cars that are less likely to have crash avoidance features and crash protection features like airbags. I think there's a great way we can improve young driver road safety through simple measures such as engineering. And engagement. As I mentioned before, my husband hasn't looked at a single resource, has not read anything online, any materials that I've printed. He's just a normal parent. He's busy, we're juggling kids and work. He's not engaged at all. Our daughter was handed logbooks and told, fill this in. I work with professional driving instructors and they say to me it's really difficult to engage with the instructor, with the learner and their parent post-lesson because they'd like to give homework. This is what we covered in the lesson, this is what we would like you to practice in the meantime. I don't think we engage really well with people who play a role in young driver road safety at all. And it points to the question, who should we actually engage? Here we are trying to fix the young driver themselves. Who should we? So as a psychologist, I love this definition of insanity, doing the same thing over and over and expecting different results each time. Consistently around the world, we've known for more than 60 years young drivers experience this problem. We keep trying to fix the young driver. How about we try something innovative? So some definitions of innovation: a new idea with significant positive change, and that's what all my research is about. I prefer to think of young driver road safety as being a much bigger picture, and this is consistent with systems thinking. That young driver is just one cog in a much larger machine, and unfortunately, if there's a crash, they're the one who's actually paying the ultimate price, bearing the burden of that crash. So take notes, there'll be a test at the end on this fabulously interesting slide. What I want to draw your attention to is that second bottom row. The left-hand side, the first shaded bubble we can see is the young driver. That tends to be the person that we focus. But as we can see by the 83 shaded bubbles on this page, these are all the groups, the individuals, the stakeholders, the agencies, the departments that I've identified just in Queensland who play a part in the young driver road safety machine. But do these groups work together? I would argue they don't work up and down across the levels, and even within each of those levels we have limited communication, collaboration, interaction. We certainly do not have an effective young driver road safety machine. If we did, I wouldn't have a job. We wouldn't have any people hurt in crashes with young drivers. What is encouraging? What is promulgating this situation that we're in? We have isolated researchers with a single discipline focus, and in many respects that can just be part, unfortunately, a dreadful outcome of the research process. So as I became more specialised in my research, moving from undergraduate degrees to honours degree and then a PhD, you become an expert in a very narrow defined area. Branching out beyond that focus can be very tricky. I've moved beyond young driver road safety to adolescent road safety, thinking about road safety in the role as a pedestrian, a passenger, a cyclist, a motorcyclist, someone on a scooter. Isolated projects. Again, this can be an artifice of the way we actually conduct research. We tend to work by ourselves because we are competing for the ever decreasing budget that is put aside for research to improve road safety around the world. I think we're very lucky in Australia and countries like New Zealand. We are developed countries. We have a dreadful road crash burden, but if we look at the bigger picture, it's actually the less developed countries that bear the most burden, and I think sometimes we forget that. If we're looking at research, we tend to find it's from weird countries, so our Western, educated, industrialised, rich democratic countries. That's great. We need to know what's happening in those countries. However, we can't just assume that the situation that's occurring in our country is the same as another country and that an intervention that works here will work in, for example, Nigeria. One of the solutions I've come up with, I've started an international research consortium, and I'm very pleased to say it's growing every day, which is just wonderful. If you'd like more information beyond what I present today, I'm very happy for you to direct email me and I can inform you about what's going on. This is getting away from that isolated thinking. It's a consortium of adolescent road safety with the acronym CADROSA. Instead of being competitive, we are all competitive within Queensland, within Australia, within Australasia, around the world. We are competing for research funds, for publications, for grants, for scholarships, for postdoctorates. Let's be collaborative and cooperative and actually work together. I think we've got a responsibility in a developed country to be helping countries that are less developed, and as part of that less development, unfortunately they have fewer social and financial resources. We're in a really great position here in countries such as Australia where we can say, hey, we have this capacity to mentor you, assist you through this project. We may have 50 people in Australia with expertise, and a country example such as I mentioned, Nigeria, may only have a handful. And as I mentioned before, it's road safety per se. So dying in a car crash is one of the most common ways young people die, but they are also more likely to be killed as a pedestrian, as a cyclist, motorcyclist, scooter rider. These point to we need to intervene in adolescent road safety, not just adolescence as a pedestrian, adolescence as a cyclist. Again, that brings back the silo thinking and the competition. Another important element of this consortium is that we are coordinated and we disseminate our findings. So many countries, we're very lucky again here in Australia, in my own research institution, I have the capacity to access publications in the world's leading research journals for free. And that is because I'm in the fortunate position where my institution pays those fees to access those journals. And again, when I publish, there are no fees. There are countries, unfortunately, that don't have that same situation, and I think we can assist with the dissemination of findings. If we've been through that publication merry-go-round, it can be quite a challenging experience. People with less experience may become disheartened and not actually share their findings. I think the other thing too that's really important is that we're conducting multi-country projects simultaneously, so that rather than spending 5 years securing a grant, getting ethics approval, gaining the data, analysing the data, reporting the data, and then the publication merry-go-round at the end of 5 years, we might have one study here in Queensland, 100 participants. Can we generalise beyond those 100 participants around the world? I would say no, and I would even argue that we can't even generalise to the Queensland context. Whereas if we've got multi-country projects and we can generalise the findings back to those countries, and we're sending this out into the research community, the policy and practitioner community. We can make a global difference in a far shorter time frame. Any questions?
Okay, thanks Bridie.
Well,
That was
thank you,
great.
Bridie.
I will just check. We have
Yes,
one hand up. So Linley. Linley, do you have a question? Okay, I've unmuted Linley and doesn't seem that there is a microphone at this point in time, so we might see if we can get Linley to write the question. If anyone else has got a question with their... Okay, Linley, we'll try again. No, it's not coming. We're not getting Linley on there. So, Linley, if you could actually just write your question on there, we can ask Bridie that on your behalf. I don't see any other hands up at this point in time, but I'd just like to say I find that it's wonderful to hear that you're looking at doing that collaboration. It really links in with safe communities and particularly globally as well. So if we can help disseminate any information in any way, we're certainly open to sharing that with our safe communities, putting it on our websites and doing anything else that we can to support your work as well.
That would be fantastic. And I hear from people, but I don't do anything with adolescents. What can I do? So I have colleagues who are police. Of course, they're the ones out there enforcing. I've got engineers who've joined the project. I don't know anything about engineering, but of course engineers play a vital role from the car the youth is in to the roads they're driving on. We need to work together and move away from that idea of road safety researchers only working with other applied social psychologists. Everyone can bring something to the plate, no matter how small, and even if you're just a mum of a teenager, your role might be that you're a participant in a research project, and that would be wonderful if we can promote a fresh way of looking at it. I think we can make a global difference in that far shorter time frame. Because of course in the meantime, while we're not fixing this problem, it's not just the child that's bearing the burden, families and communities. This is a community problem, and families and communities can be destroyed by one terrible young driver crash that might take out 5 boys in one hit.
Okay, I do have a question that's come through now from Kathy Graham that says, do you believe even separating road safety out so much sometimes as a single target doesn't recognise that it is often symptomatic of wider issues within a family, for example, or community?
That is a fantastic question, Kathy. Thank you for that, and you are exactly right. It's interesting, as human beings, we love to categorise things, and this serves an evolutionary purpose. So if we think back to the olden days, we had to decide really quickly, was this animal that we saw a predator or prey? Am I at risk? Am I safe? What will I do? These categorisations happen at many levels completely innately from the evolutionary context. Then of course we complicate it when we bring in bureaucracies and we bring in government departments and we bring in specialists that only look at something from a particular direction and forget that we are actually dealing with a community issue. So for young drivers it's really complicated because we forget they're teenagers. Teenagers are meant to take risks. Teenagers are meant to show off in front of their friends. Teenagers are meant to test the boundaries. All of this feels good. All of it is really important from a developmental psychological perspective. When we know this is what they do, it frustrates me when I hear from parents, they're only going to have a crash anyway, I'm going to buy them a bucket of crap for the first car. I don't understand the logic. If you know they're going to crash, my own son is 16. He does not have a driver's license. I know he's a risk taker. When he has demonstrated to me that he has some capacity for self-regulation, we will talk about getting a learner license then. My husband's 46. I'm not thinking it's going to happen anytime soon. We need to look at road safety as just one part of life, and we need to be focused on protecting teens. And that's the idea of my research unit. If we can just get one generation of teenagers right, they're the mum and dads for the next generation. then they bring up the next generation and we are all safe, whatever the mechanism of risk. Then if that generation becomes the grandparents of the next generation, my dream is that we have actually then fixed injury. We have prevented injury across the lifetime, and we have prevented injury, not just the road. Self-injury through suicide, because unfortunately that is the other great threat to teens. And I have heard from young men in particular that they have considered their suicide plan will be a car crash. They can say to mum and dad, their parents then can say afterwards, my son died in a car crash, rather than my son killed themselves. So Kathy, you're exactly right. We need to look at this differently. This isolated thinking and the reactive approach that's taken by different departments isn't contributing to safety. I would argue it's contributing to non-safety across the spectrum.
Thanks, Bridie. I've had a number of questions coming in now. Unfortunately, we've only got time. We'll do one more, and then what I'll do is I'll forward the questions to Bridie with your name and contact details and see if she can get back to you if she has the opportunity.
Fantastic.
So the last question is around whether you have researched whether young riders on mopeds are more at risk as they have not gone through a process of rider testing, which are the rules in WA, and that's from Karen White.
Okay, thank you, Karen. Excellent question. So when I hear of young people on a moped or a motorbike or a scooter of any sort, my skin crawls. I hear from young drivers it's a cheaper form of travel, and in instances there's less testing. I am all for them having the illusion of metal wrapped around their bodies, hopefully a seatbelt, an airbag. That would be the minimum I would like. So if at any point anyone's talking to a young person and they're saying it's cheap, it's easy, it's fun, encourage them at least to get inside that metal shell with a seatbelt and an airbag. We definitely need to look at training and testing. It's complicated because we assume when we're training a young person that they are an adult the same as us and that they're listening. I don't know if anyone listening has teenagers. Pretty well all the time they're hearing wah 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 chocolate, wah 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 ice cream. We can talk at them until we actually engage with them and talk with them when we're doing our training. I think we're limited in the capacity of any change that we're going to be able to make. It's difficult when we're asking them to regulate their behaviour as a 16 and 17-year-old, particularly young men, when we know their brain, the part that regulates decision making and fully considers consequences of behaviours, isn't finished cooking until their late 20s. Think of the mischief they can get up to in that time. It's also complicated further because we don't actually know what a safe, in the context of young driver, we don't know a safe young driver, and we don't know what a safe young moped driver looks like. So how do we train them to become that when we don't actually know what that looks like? There's no easy answer to that question, unfortunately, Karen, and it is a definite area of investigation and one that I'm especially considering. I have projects running in Malaysia and Indonesia at the moment where the two-wheeled, powered two-wheelers are far more popular than here. So I'm actually hoping less developed countries can help inform us in Australia in a more developed country.
Okay, Bridie, if everyone can bear with me, I have Peter Schrader who's actually begged me to ask the question, and I've never had anyone on our webinars beg. So I will ask his question, which is around the evolution. With the evolution of communities to driverless cars, will the issue of adolescent driving risk be less of a public health issue in the future? And on that matter, sorry, I've moved the screen. On that matter, will driving risk in general be less of an issue with driverless cars?
Two double-barreled questions. Yes, very good, Peter. Two excellent questions. So I'm just going to comment on the last one first, the driverless cars. It's the conceptualization in the general public is that a driverless car means that you'll just sit in the car and it's a bit like you'll just suddenly arrive at a destination and you won't have to do anything. The latest driverless cars that we have seen in the research realm require the driver to take over in an emergency situation. The car could be predicting that there's going to be a crash and the algorithm that's written couldn't decide what is the thing. Do you choose to run over one child who's wearing a helmet while they ride their bike, or do you choose to run over two children who aren't wearing helmets while they ride a bike? We have to write the algorithm to choose that. At the moment, the technology says that driver is going to have to take over straight away. So with my expertise in young driver road safety, that freaks me out completely. That means you actually have to be even more hypervigilant to be alert that the car is going to suddenly change from autopilot to you requiring emergency avoidant responses. Given the technology that's there at the moment, that says to me we're actually going to have more crashes and we're going to have more of a road safety problem. Particularly in the interim, when we're looking at countries around the world, this is going to be a massively expensive transition if it comes into countries all around the world. So the short answer, I think we're actually going to have more crashes, and I'm very concerned that teenagers who use a mobile phone now when they're driving the car are more likely to use their mobile phone, and then when the car says, you have to take over, they're not going to be ready. Freaks me out. The first part where you mentioned about the driverless communities, Australia, I often hear this comment in Europe, for example, I've been to the Netherlands, the bicycle rules, pedestrians rule, and the car must give way. Much smaller countries, much more dense population, much older countries that have evolved that way, whereas Australia really went an isolated community, we had horse and buggy, and then when we could actually travel long distances, the horse and buggy became very unfavourable, car uptake was highly popular, and the capacity for the bicycles and the pedestrians fell by the wayside. The communities that we currently have, as an example here on the Sunshine Coast, there is just no way to get around on bicycles or as a pedestrian. You have hinterland, rural, mountainous areas with 110 kilometres an hour as the highway. You have congested city. The tourist season, the Sunshine Coast is a very popular destination. The locals call it the terrorist season because the people who arrive on the coast aren't from the coast and will drive in a manner that suits where they've come from. For example, Sydney, it's quite a different driving style. I'd like the movement direction to be towards safe transition, safe travel for every person, and I think we should actually be looking at road safety completely differently, which is part of what I'm doing in my unit as well. When you have a toddler, you are growing a young driver, you are growing a young cyclist, you are growing a pedestrian. That toddler then becomes an active pedestrian and is learning about being a cyclist, but at the same time is understanding driving risks. We try to teach a lot of things after the ball has already run out and we're shutting the gate. I think we need to actually do it from the very first moment we turn the car seat round in the car. I defy anyone to try and hide a chocolate bar when they've got teenagers. You cannot hide a chocolate bar. They see everything. We need to engage them right from birth in road safety and injury prevention across the spectrum instead of waiting till the horse has left the paddock and we race around trying to do something.
Well, thank you, Bridie. You've certainly stimulated a lot of interest out there and given people plenty to think about. I'd now like to introduce our second presenter for today, Catherine Pulford, who is the Road Safety Coordinator with the Upper Hutt City Council in the Wellington region of New Zealand. Today, Catherine is presenting on initiatives in the Hutt Valley which support the vision of safer journeys. This is New Zealand's road safety strategy.
Hello and kia ora from touring in New Zealand and Australia. My name is Catherine Pulford. I've been Road Safety Coordinator with the Upper Hutt City Council for the last 18 months, so still quite new to the job. Okay, this webinar, this presentation is all about safer journeys in Hutt Valley, and for those who don't know where Hutt Valley is, it's an area just north of Wellington in New Zealand, and the two main cities in the Hutt Valley are the Upper Hutt City and Lower Hutt. Okay, Safer Journeys is New Zealand's road safety strategy to 2020. And the vision of Safer Journeys is a safe road system increasingly free of death and serious injury. The approach is to work across all elements of the road system. It's roads, speeds, vehicles and road use. From the national statistics, areas of concern have been identified as of high or medium or of an emerging focus The areas of high concern are alcohol and drug impaired driving, young drivers, roads and roadsides, which includes intersections and roundabouts, speed and motorcyclists. The road safety initiatives in the Hutt Valley focus mainly on these areas of high concern, but if other areas present themselves as an area of concern, then they're also addressed. So in Upper Hutt, our older drivers, or older road users, not just drivers, are our second most vulnerable road user group. So the following slides just show some of the down at the sort of grassroots level, some of the road safety activities done in the Hutt Valley over the last year. Alcohol and drug impaired driving is the first area of concern in this presentation. Now, I've put throughout the presentation, I've put lots of links to some of the things that I'm referring to. We support the New Zealand Transport Agency's national campaigns wherever possible. Two very successful current campaigns are the Legends and Limits campaigns. And resources like bar mats, posters, stickers, table talkers, all printed with the alcohol message, have been distributed to bars and clubs, and this supports the bar staff with their responsible host obligations. Similar alcohol messages have been put on billboards and bus stop ad shells along local roads. And another exciting new alcohol initiative has started in Upper Hutt. It's called the Alcohol Impaired Education Program. It's a Marae-based initiative targeting repeat drink drivers who are on community probation. It's a collaborative effort by a number of agencies who are keen to lower the incidence of drinking and driving and the disastrous consequences that can follow. Our young drivers, I think this Australasian, maybe worldwide, are overrepresented in crash statistics. There have been a number of changes to the graduated driving licensing system over the last 5 years. The age for getting a car licence has increased to 16 years. There are now maximum time limits a driver can stay on a learner or restricted licence. And in April this year, NCEA credits for passing each stage were introduced. So to help communicate this new information to our young drivers, we have done a number of things, putting displays in public and college libraries and editorials in local papers. We also promote interactive websites that help reinforce the knowledge and skills needed at the learner and restricted stages. There's a great new free website and learning tool created by the New Zealand Transport Agency. It's called Drive, and it's designed to help young people become more confident and capable drivers and prepare them for their restricted licence test. Quite handy for older drivers too. Another thing that we do in the Hutt Valley is there are a number of community organisations and groups that run learner licence courses, so we support them with funding. I think the biggest initiative for young drivers in the Hutt Valley is something called Crossroads, and at this stage the event is run every 2 years. And the aim is to educate young drivers or young people who are perhaps not drivers yet about alcohol, drugs and driving, and to reinforce the key message, good mates, good choices, which is a good link between one of the New Zealand Transport Agency's campaigns. The last one that we had earlier this year, over 1,500 secondary students attended over the week, and they watched your presentations, interactive activities run by police, fire, ambulance and a variety of road safety groups. The New Zealand Transport Agency has developed some excellent units of work in a variety of learning areas that use road safety as an authentic context. Units of work have been developed at both the primary and secondary level. We promote the use of these units whenever possible. Secondary teachers who attended Crossroads were contacted regarding the use of these units to follow up and reinforce the Crossroads message. We work alongside the New Zealand Transport Agency to promote professional development workshops they hold to introduce teachers to these resources, which are aligned to the New Zealand curriculum and include NCEA assessment items. Okay, and many crashes occur at intersections. Crashes at intersections occur because of poor observation or confusion regarding the rules. We support regional campaigns to alert and inform drivers about intersections using things like billboards and editorials in local papers. Speed is another safer journeys area of high concern. Again, we support national and regional campaigns with speed messages on local billboards and editorials in local papers. The Hutt Valley Road Policing Team addresses areas of speed concern with targeted enforcement and monitoring. To alert drivers that school children will be out and about before and after school and to adjust their speed accordingly, electronic school warning and speed signs are being installed throughout the Hutt Valley. Again, the Hutt Valley Road Policing Team monitors speed around schools, especially at the beginning of a new school term. Our motorcyclists are another vulnerable road user group. To encourage motorcyclist safety, we promote the skills training courses subsidised by the New Zealand Automobile Association. The Ride Forever skills courses are very affordable and cater for riders at different levels of ability. The Ride Forever website is also a great source of information for motorcyclist enthusiasts. We use every opportunity to get safety information to motorcyclists. Hundreds of riders travel down to the bottom of the South Island every November for the Burt Munro Challenge Rally. We met up with large numbers of motorcyclists at the Wellington Ferry Terminal on their journey south and gave out packs which included information about the skills courses, maps which would ride the lower north, and they showed recreational sort of rides, upcoming motorcycle event information and safety giveaways. Riders were very appreciative, and it was actually quite a fun time, very early starts. Another big event that was organised this year for the first time, and it's going to be ongoing, is an event called Shiny Side Up. Planning's already started for the next event in January 2017. So this year, around 1,500 motorcycle riders watched riding demonstrations and safety presentations. They also interacted with experts on all things to do with motorcycle and rider safety. So as a team in the Hutt Valley, we promoted and supported this event. We support older drivers to feel safer and more confident road users. Presentations are done at retirement villages and clubs for the older age group. These presentations introduce the New Zealand Automobile Association CarFit program and cover driver refresher information. CarFit events are held during the summer months. Older drivers are helped by trained volunteer CarFit technicians to make adjustments to their car, for example like seat height, mirrors and seat belt, so their car fits them better. After the technicians have finished, the driver meets with an occupational therapist who helps with any mobility issues or concerns. It gives you an overview of some of the road safety activities done in the Hutt Valley to address the Safer Journeys vision, a safe road system increasingly free of death and serious injury. Our goal in the Hutt Valley is to have a safe Hutt Valley with safe people and safe places. Thank you and goodbye from New Zealand. A much shorter presentation.
Well, thank you, Catherine, for sharing. I'm aware that time is marching on, but has anybody got a quick question for Catherine?
I'm just doing a quick check and it doesn't look like we have any questions for her. If anyone does have anything, contact her directly.
Okay, our last presenter for today is Susan Medica, who is a counselling psychologist and coordinator with Road Trauma Support Western Australia. Today, Susan's presentation will outline who Road Trauma Support Western Australia are and how the service works to prevent and reduce the negative impacts of road trauma.
Oh, good morning everyone and welcome. So my name is Susan Medica and I am the Counselling Coordinator for Road Trauma Support in Western Australia, and I've been with the service since it officially launched in November 2013. My role involves coordinating as well as directly providing specialised trauma and bereavement counselling services. I'm also involved in other aspects of service delivery, including peer support, preventative education and professional development. So today I'm going to speak a little bit about the psychosocial impacts of road trauma, who road trauma support are, and how our service works to prevent and reduce the negative impacts of road trauma. So first of all, just a quick word about ICWA. We are part of the Injury Control Council of Western Australia, which is a lead agency in injury prevention in Western Australia. If you'd like more information, you can look at our website. Now, how did road trauma support come about? So before the service was established in 2013, there wasn't any dedicated support services for families and victims of road trauma. So after extensive campaigning by members of the community as well as professionals in the area, a report was commissioned by the Health Department of WA. This report identified that road trauma and crashes have the potential to cause significant psychological and social distress, and recommendations were made to establish a comprehensive and statewide service to deal with these issues. Now, this actual report was commissioned and produced by Lauren Breen from Curtin University, and a copy can be accessed from our website as well. So turning to some statistics from an injury point of view, I think as Bridie pointed out, a leading cause of injury for people up to 24 years of age is road trauma. It's also the second biggest cause of injury for people in the 25 to 64-year-old category. In terms of actual numbers, last year on WA roads, 161 people were killed, representing a fatality rate of 6.2 people per 100,000 persons. Now these are actually the lowest figures recorded since 1961, and I'll talk a little bit about that in a second. So how are we travelling so far? So far this year, our total deaths on roads are 114. And as you can see, we've broken the figures down into metropolitan and regional statistics. And I think it's important to realise that Western Australia is actually Australia's largest state, and we have a total land area of 2.6 million square kilometres. So this has definite implications for providing services, support and treatment, and a flow-on effect to obviously how we manage our service. So we know that from fatal crashes, approximately 13 people are affected by every crash, and that includes people who were directly present at the scene, involved in the crash, or witnesses, first responders, as well as people who were not actually at the crash but may represent families, friends, partners and so on. So the potential for psychological and social distress following a major crash is significant for the whole community. So if we look just at last year's statistics of how many people were killed on roads, that would mean that a minimum of 2,080 people were affected by a fatal crash just in that 1 year. And that's obviously not including all the other crashes and accidents and so on. So I think this quote from our Road Safety Minister, LIZA HARVEY, actually represents a lot of what we see here at Road Trauma Support, and she says, "We must never forget that each person killed was loved by someone and is not a simple statistic. A life has been lost and the lives of those left behind will never be the same. and that's definitely what we're dealing with on a daily basis here. And I think it's sometimes quite easy to read the newspapers and watch the news and look at the road toll and think, well, that's not going to happen to me, and we kind of like distance ourselves from that, but we have to remember that it can actually happen, and based on statistics it's probable that you do know someone who's been involved in a crash. So who are the people who are primarily affected by road traffic crashes? And what we found is that they fall into 5 general groups, and they are people bereaved by the crash, so they are the parents, children, partners, siblings, grandparents of people killed in a crash. The second category is people injured in the crash. Third category is friends, families and unpaid carers of those injured, and here I'm primarily referring to the people who are looking after someone that's got quite severe permanent debilitating injuries. The fourth category is witnesses and first responders, and the fifth category is drivers who allegedly caused a crash, and also their families. Now, these categories aren't, of course, mutually exclusive. For example, you can be in a situation where you are driving a vehicle, cause a fatal crash, and a member of your family or a friend who's a passenger in the vehicle may also be killed in that crash. You may also suffer injuries yourself. So you would find yourself in a situation where you're being investigated for a criminal offence, as well as dealing with your own grief and dealing with your own physical recovery. And we certainly have seen people in that situation through our service. So just a little bit about breaking down those categories a little bit more into some of the effects that we see. Obviously, a lot of the effects are similar across different categories, but there are some unique features. So for family members bereaved by a crash, which is a large portion of the clients that access our service, we see fairly intense grief and often prolonged and complicated grief. And there's a few reasons for this, and one is that road traffic crashes are quite horrific events. They're very sudden and unexpected, and as has been already pointed out, they often involve very young people in the prime of their lives. They may also involve babies, children, pregnant mothers, etc. And so the potential for trauma and enduring grief reactions is actually very, very big. We see comorbid sort of psychiatric issues like depression, anxiety, reduced functioning in relationships. Sometimes marriages actually break up through the loss of a child through road trauma. We see post-traumatic stress disorder, which is often forgotten about in this population because people are very focused on the grief, and in fact there's also a lot of comorbid trauma relating to how the crash occurred and the events that actually happened to a loved one. We also see difficulties then with finances, insurance, compensation, coronial and forensic issues, and this can also lead to a prolonged grief reaction where people are having to continually deal with situations like court processes, and sometimes this can happen a year or two after the crash. So as people are trying to rebuild their lives, then they have to start to unpack and deal with the trauma again. So the second category is people injured in a crash, and I guess the difficulty is when injuries are very permanent and severe, like paralysis, quiet brain injuries, amputations, burns, and this can have ramifications for the person's life in general. They may lose ability to work, to study, previously enjoyed pursuits. Obviously it affects their relationships. Finance is a big issue. So we see a real change in the quality of the person's life, loss of independence. And one of the main factors that we see in this population as well is a very strong focus on, in the medical system, on physical recovery. And there's probably a little bit less of a focus on their psychological challenges. And we often do find that once people have left the hospital system and have ceased all the physio and OT and all the things that go on, and they're left to sort of cope, that's when often the psychological issues start to come to the fore. And certainly in this population we do see a lot of post-traumatic stress disorder, potential for ongoing depression, anxiety, alcohol and drug issues, and chronic pain. Now, in the third category are people who are looking after these people who are severely injured, and again here we see prolonged sort of grief and trauma. It's actually said that in this population often the grief doesn't end, it just continues. There's ongoing stress, ongoing challenges. There's not a finite loss, there's rather like a continual need to respond. These people are often finding themselves again in financial hardship. They suffer burnout, stress, exhaustion, their quality of life decreases, and we really see that there's a real gap here in service delivery, that often these people are actually struggling to actually find the practical help that they need. In terms of the fourth category, witnesses and first responders, this is a very large proportion of who we see, and they are people who may have inadvertently find themselves involved in helping, assisting at a crash or witnessing a crash, seeing some horrific things, and they really do experience some very strong sort of initial stress reactions, and the potential for recovery is actually very good in this category, especially if people are serviced fairly quickly, and they often will do well with just 1 or 2 sessions. However, for people who maybe haven't accessed assistance or have prior or existing issues, there is also the potential to develop post-traumatic stress reactions in the longer term. This is kind of a category that I think where we can actually have a really huge impact and really get people back on their feet. Sometimes they really are struggling in the first weeks and days after an event, trying to make sense of it, and bothered by lots of nightmares. They feel they can't go to work. They may have crying episodes and things like that. But as I said, we can very quickly start to resolve some of these with some psychoeducation and support. And the last category is drivers who have caused the crash, and there's just a number of issues. Again, as I mentioned, sometimes these people can overlap with the other categories, but key to this is their social stigma and the isolation that they may experience. They're also being investigated, and this often has effects on their employment situation, having to attend court, those sorts of things. Of course, the end result can be incarceration, and we find that this has a huge impact again on families. Sometimes parents obviously with children are placed in jail, and then there's obviously difficulties for the whole family. We have seen people again in this category, and sometimes as a result of all the stress they actually do experience suicidal ideation and lots of other problems. Okay, so really just a summary that of all the ways that road trauma does affect us, and I've given just a very, very quick overview because I'm aware that we are running out of time. So what do we do to assist this? Basically, we are a service that's set up to provide support to anybody affected by any aspect of road trauma, and as you can see from the previous slides, that can be from any one of those categories. There is no time frame for when we will assist people, so the trauma may have occurred. Certainly one of my longest clients, her trauma occurred approximately 30 years ago and was never dealt with, and she's coming in for counselling now. So there's no time frame. We are a free service to people. We provide obviously the information, psychoeducation, which is a key part of assisting people, so helping them to understand and process their reactions, helping them to restore quality of life and functioning. We have a peer support component, and we provide the counselling, which is done face-to-face or via telephone or via Skype, which again becomes important when people are living in rural areas. And there's also a component of our service dedicated to preventive education and training. So we're not a medical service, and we're not a crisis service as well. So we do obviously link in with other services to assist people and allow them to access the help they need. I guess we also link in, it's worth mentioning, other services involved in this area, so victim support services, coronial counselling, the WA Police, hospitals and so on. So that's really probably the essence of what I'd like to cover today. Please have a look at our website, check out our Facebook page, and also follow us on Twitter. It's very important that the word gets out there that we exist. We often find people accessing our service, coming in and saying that they've tried to obtain help perhaps from their local community, or gone to their GP, or contacted the EAP and so on, and they just haven't found the specific support that they need. And so it's really important that the word gets out there that we do exist. We are a fairly new service. As I said, we've been around for about 2.5 years, and our referrals have slowly built. And I think it's important that we continue to promote that message that the service is there to assist people. So thank you very much.
Thank you, Susan. We appreciate your sharing today. Does anybody have a quick question for Susan?
Just looking. So Peter Schrader asks, are GP groups aware of your service?
We do try to promote our service, and we've certainly done a lot of mail outs to a variety of organisations, including hospitals, GPs, other counselling services, schools and so on. The difficulty, I guess, is with accessing, like, obviously the sort of hundreds, thousands of GP practices that are available, and also you know, how do you get your literature to be looked at, because obviously they're inundated with a lot of different brochures, pamphlets and so on. So that's certainly something we work on constantly, and through word of mouth we continue to spread that message out there, and yeah, try to get people to know that we are available.
And just one final one from Shane Pope says, do you have materials available for those on the ground to help promote your service at community events?
Absolutely, absolutely. We have a variety of, if you actually look at our website, you can actually order or download. We have a variety of fact sheets that we've produced that cover some of the different issues for people. We have brochures, we have little handouts, and certainly we do events, and we do have a lot of information and stuff that you can pick up. And we have these little wallet cards as well that police, for example, use, and they can hand them out at the scene, so people can just pop them in their pocket and perhaps look at it later when they you know, have dealt with some of the immediate consequences. So if anybody would like to order, all our material is free, so if they would like to order any promotional material, definitely contact us.
That's it for the questions.
Thank you. Okay. Okay, thank you, Susan.
Thank you.
Do we have another question, Megan?
No, I think that's it for now. I'll put the other two presenters who had questions for each other in contact with each other.
Okay, all right, we will just move on. Well, on behalf of all the participants, I'd like to thank all our presenters today for taking the time to share with us. Collectively, you've all given us plenty to think about going forward. Please feel free to email any of our presenters with any follow-up questions you may have. And just a reminder to all our participants today to fill out the survey on this webinar and let us know of any topics you'd like to see covered in the future. We welcome all feedback. Our next webinar will be an update from the World Safety Conference, and that will be on Thursday the 20th of October. And we will send out some reminders about that closer to the time. And just a final reminder that the recorded webinar link will be sent via email to all participants and will be available on the Australian and New Zealand Safe Communities websites sometime next week. So please feel free to share these recorded webinars with your colleagues. Thank you everyone for your time today.